Welcome to our webinar, With Insight Yet Out of Reach, Predictive Analytics in Healthcare. Brought to you by the Center for Connected Medicine and its partners, GE Healthcare, Nokia, and UPMC. I am Oscar Marroquin, a practicing cardiologist at UPMC, an associate professor of medicine, epidemiology, and clinical and translational sciences at the University of Pittsburgh, and the Chief Clinical Analytics Officer for UPMC. In that role, I lead the health system's clinical analytics activities, which include overseeing a team of analysts, statisticians, and data scientists focused on applying big data approaches to measure and predict clinical outcomes. I'm really excited to be moderating today's webinar, which will provide valuable insights on an important topic for health system leaders to understand. I am also delighted to have with me for this discussion two panelists who will bring a wealth of knowledge and experience in healthcare and big data. Joining me today is Dr. Mona Siddiqui, the Chief Data Officer for the Department of Health and Human Services.
Thank you. I'm excited for this conversation today.
Thank you, Mona. Mona is really focused on promoting open data, building an enterprise-wide data governance structure, creating a business analytics unit, and developing strategic partnerships with external stakeholders. Prior to this role, she was at the Centers for Medicare and Medicaid Innovation, working toward implementing a rapid cycle testing platform for payment models. She has an MD from the Johns Hopkins School of Medicine, where she's also an assistant professor of medicine. So we thank Mona for joining us.
Thank you.
Bringing us an industry perspective is Mr. Travis Frosch. Travis is the Senior Director of Analytics at GE Healthcare. In his position there, Travis is responsible for regional data and data science in North and South America, and the Applied Intelligence Cloud and on-premise business intelligence platforms for the company. He also oversees the company's analytics product management, innovation, and incubation programs. Travis has 17 years of healthcare industry experience covering multiple verticals, with 14 years of proficiency in analytics and artificial intelligence on various platforms. Thank you for being here, Travis.
Thank you very much, and thanks everyone for joining today.
Well, together with my two esteemed panelists, we plan to give you a deep dive into the state of predictive analytics in healthcare today. It's a pivotal topic, in my opinion, for healthcare systems, which are amassing tremendous amount of data each year, and at the same time, searching for ways to improve health outcomes for patients and create a more value-driven system for delivering care. Predictive analytics really offers the possibility of putting all of that data to work to provide insights as we deliver care. But it's not an easy task, and there are a number of reasons why healthcare has yet to fully realize the potential of its big data, which we will be talking about today. So with that in mind, let's quickly set the stage for our discussion by reviewing the results of a recent survey on predictive analytics in healthcare that was sponsored by the host of today's webinar, the Center for Connected Medicine. For this research into predictive analytics, the center partnered with HIMSS Media to conduct a survey of 100 hospital and health system IT leaders. The survey found that 7 out of 10 hospitals and health systems are taking some action to formulate or execute a strategy for predictive analytics. This is perhaps not surprising when you consider all the attention predictive analytics receives in the healthcare trade media. As my colleague Pamela Peel, the Chief Analytics Officer of our health plan and of UPMC Enterprises told HIMSS recently, demand begets demand. Healthcare systems want to be part of it because the dominancy in the industry is to consume predictive analytics. However, despite the strong interest by healthcare providers to employ predictive analytics, few healthcare systems can say that they have widely implemented full-fledged analytics that identify the likelihood of future events, and further, that they set a course of action based on those findings. You can see that while 69% of respondents said their organizations were effective at using health data to describe past events, that number drops to less than half when it comes to using data to predict future findings. I think it's normal to ask, why is this? According to the survey, 2 of the top challenges involve talent and lack of interoperability. Put another way, health systems have trouble getting access to all the necessary data in a useful and standardized format. And then they don't have the people in place to apply statistical algorithms and advanced machine learning techniques within the complex practice of medicine. You can read more about the survey and download an infographic and executive summary by going to the Center for Connected Medicine website, connectedmed.com. I would also like to let our audience know that we encourage you to ask questions either through our webinar platform or on Twitter. After the webinar is over, we will collect all the questions that come in and answer as many of them as we can. We will post our responses on this Center for Connected Medicine blog. If you post a question on Twitter, please tweet at Connected Medicine, at Connected Med, and use the hashtag Predictive Analytics Insight so we can find it. So with that bit of housekeeping out of the way, let's jump into the discussion. Mona and Travis, thanks again for joining us this afternoon. I have a number of questions I want to get to, but to start, I'd like to ask each of you to introduce yourself briefly by giving us an overview of your experience with predictive analytics and big data in healthcare. Mona, why don't you go first?
Thank you so much. And again, thank you for including me in the conversation today. I think this is an incredibly important topic and one that the Department of Health and Human Services is facing as well. So my experience here really as the first Chief Data Officer for HHS is really about how do we make HHS more interoperable. We consist of about 29 different agencies, such as the FDA, CMS, NIH, CDC, and others. And how are we using our data and how are we connecting the data across these different silos to create more business value for the department and how we operate? It turns out that we just don't have that infrastructure in place. And so projects end up often being on a one-off basis rather than in service of larger strategies and priorities that we're facing. So that's what I'm currently focused on, is creating an enterprise level data governance and interoperable structure. Prior to this, I was also helping CMMI think through rapid cycle model deployment using, again, a very data-driven approach. And my first foray into the federal government and data was with the White House Social and Behavioral Sciences team during the Obama administration, where we embedded insights from behavioral economics into government programs and then ran randomized controlled trials to see if those interventions were effective and efficient. So from a perspective of how do we use big data to make government run more effectively and efficiently, that is the area where I've been focused on for the last several years.
Thank you, Mona. Travis, can you tell us a little bit more about your background in analytics?
Sure. And again, thanks for having me as a part of the webinar today, and really looking forward to the conversation here. As you mentioned earlier, I have 14 years experience of analytics across all maturity levels, which includes advanced analytics, and that's sort of where predictive analytics falls. Very much like Dr. Siddiqui, where at GE we're looking at our assets that we can utilize to drive predictive analytics. So for example, in the imaging diagnostic space, we have an installed base of over 1 million devices. those 1 million devices are generating 16,000 scans per minute. In our diagnostic cardiology space, we monitor and have 500 million ECGs under management. And our bedside patient monitors generate 1 gigabyte of data for one bed for one day. So you can see where we would have very similar struggles in helping institutions kind of normalize that data, aggregate that data, and really drive to those predictive outcomes. That's what we're focused on at GE. We're looking at how we can provide precision health to the healthcare system globally and really capitalize on the data that they're generating at sites and that we're generating with our assets.
Great, thanks Travis for that. So why don't we jump into sort of the first question. I mean, you know, we all hear predictive analytics being used. This sounds a lot like a buzz phrase without a lot of substance. Is that how you see it? Mona, maybe can you start?
Sure. So it's interesting. I think as part of our larger social ecosystem, we talk about data generating value all the time. And yet we don't talk about all of the messiness in that arrow that goes from data to value. And that is really where all of the hard work comes in. And so while absolutely I think big data and the promise of big data and predictive analytics is real, I don't think a lot of organizations have thought through the tough work that needs to happen in being able to provide the infrastructure that enables predictive analytics. And so, you know, I think a lot of practitioners within healthcare then start to see this as a buzzword rather than something that's creating real value. So I think, you know, there's a lot of work that needs to happen before we start to see consistently across the healthcare sector value coming from data in the way that we all think we should be.
Yeah, Travis, what do you see from your perspective?
Sure, I think it depends on how the word and the phrase predictive analytics is used. I think in the way that Mona just described, in sort of that sweeping generalization in big numbers, it is overblown. So we heard a moment ago about how hospitals generate petabytes of data a year, right? In actuality, only 3% in a recent survey, only 3% of healthcare data is actually tagged for meaningful analytical use later on. So 97% of that, those petabytes of data is going down a drain. And I think that's really tough to swallow. But on the flip side of that, if you look at specific examples, you can really see how the promise is achievable. Things like predicting insurance claims denials, things like predicting capacities and throughput and command center type functionality. So as a whole, I think many of these terms are inside of the hype cycle, but I think if you thin slice it and look at what are examples where people really are achieving high quality outcomes, they are there. Just maybe not as widely adopted, and we'll talk about some of those challenges later on in today's discussion, but definitely some thin slices, but as a whole, it's pretty hyped.
Yeah, and I would agree certainly from my perspective here at UPMC, what I find is that the phrase does not necessarily have meaning when predictive models are put in front of clinicians, and something we'll talk in a little bit. But I think that putting it in the context of the whole continuum of analysis from exploration and discovery that usually leads to hypothesis and identification of opportunities for which predictive models can be built is one way of allowing us to move from just a buzzword to something that's a little bit more real. But I mean, maybe with that in mind, why do you think that this survey found that organizations are trailing off as they try to move from descriptive analytics to predictive? Maybe Travis, can you get us started there?
Sure. Three quick reasons come to my mind here. One of them is what Mona was highlighting earlier. Often predictive analytics with a high degree of accuracy require varying data points, and that governance and integration, as the survey showed a few months ago, and as Mona outlined, is very difficult. It's very hard. right? So that's kind of the first reason why organizations are moving more slowly from descriptive to predictive. I think the second one, and it's highlighted by the survey, talent is very hard to come by. So not only are healthcare systems and providers and payers even trying to source this talent, but think about the disruptors in all industries. It's very similar sets of skills, right? Data scientists, data architects, data integrators. So there really is a drying up of the talent pool, and the competitiveness is very difficult to obtain and keep that talent. And lastly, and this came sort of right in my face as a product manager years ago of an analytics solution, predictive analytics is very disruptive. We had one of our great partners at a healthcare organization who was doing a trial of some of our solutions, sort of stand up at a national sales meeting and say, yes, predictive analytics are incredible, the capabilities are fantastic, but sometimes it can break the way a healthcare system thinks. And to that point, to do it right, I think you really need complete buy-in at the highest level of an organization. Predictive analytics are very polarizing, and if you don't have that type of support, it can almost paralyze an organization with what to do next.
Oh, those are all great points. And Mona, from your perspective, why do you think that we in healthcare have been trailing off in this movement?
Yeah, so I would agree with all of the points that Travis made. I would also add that healthcare data is also just much more highly regulated because healthcare is highly regulated. And we see that at HHS as well. Our agencies are all operating under different statutory authorities. Our data is regulated by a variety of different statutes, and harmonizing the way in which those statutes get and those regulations get applied across the department presents a challenge when we're trying to integrate data. And we see that every day, and that's one of the challenges that we're trying to address from an enterprise level, to de-risk the sharing of data from individuals and create an infrastructure that enables that sharing without having to go through legal agreements every single time. So I think that is that's a huge component. I would also add that some of the challenges that Travis pointed out, I think, in the private sector are similar to what we face. So the talent pool and retaining the talent pool is an incredible challenge, I think. And the other thing I have seen is that while we talk a lot about sharing data and using data for business intelligence, we don't often resource our teams appropriately to be able to fulfill that promise. And so thinking about capacity building over time, I think, is also incredibly important.
Yeah, no, those are great points. And I would say from our experience here at UPMC, to that last point specifically, we never really were able to truly consume our data and truly derive insights to drive how we deliver care until we actually had a dedicated team to do analytics. I mean, traditionally, a lot of these functions have been done sort of as a side job or whatnot by other members in IT systems and whatnot, and we have found that having a dedicated sort of team is absolutely necessary to move us in that continuum. And so maybe Mona, can you talk a little bit about, given all of these hurdles that we've talked about, what would be some things that healthcare leaders can do to overcome these hurdles, maybe from your perspective from the HHS?
Yeah, so, we really see the department as taking a lead in setting the things that need to happen in order to create that infrastructure. So we recently put out a report on the current state of data sharing at HHS, and again, 29 different agencies. So just imagine the incredible challenges there. But what we are doing is really creating that enterprise level infrastructure. But as we do that, and that requires long-term commitment, I think the other piece of it is creating value that people can see. as the hard work of laying out the foundation is occurring, we also need to make sure that people who are both the leaders within organizations and people who are sort of frontline program managers or clinical staff are seeing the value that gets created from the use of data in a way that is seamless. And so that's what we're focused on, to making sure that HHS data can yield real results for some of the biggest challenges that the department is facing right now.
Yeah, that's certainly of utmost importance. How about from your perspective, Travis, what do you see as things when you work with healthcare systems that healthcare leaders should be thinking about to overcome these hurdles?
Sure. I think that, and it's sort of reflected in the survey results, I think that organizations need to start small. Start thinking about, what are the problems you're trying to solve for? And then what's the data needed to meet those problems? If you are an organization that does not have a high maturity of analytics, you might not want to start a big, huge predictive analytics project. You may want to start with traditional reporting or BI to sort of build the trust and the foundation that's required to move towards more a higher level of analytics maturity. So things that are highlighted in the survey are challenges everybody sees: difficulty integrating the data, shortage of data scientists, data governance. The one thing I think it's interesting based on the survey is 2 and 5 are sort of directly related, and that's the lack of available budget and then the ROI. This kind of goes back to my point. If you get a good ROI, then you probably can open up some of that budget for furthering your analytics journey, right? So it's sort of self-funding, if you will. Now, the problem is you must have a foundational analytics unit or infrastructure in place to measure the impact of ROI. So one thing that's absolutely critical, and we've taken this exact path at GE, is we have to offer those lower level analytic maturities, such as reporting and business intelligence, to showcase the value of predictive analytics or even some of the different types of artificial intelligence. Without that operational understanding of where you currently sit today and what are the problems that you can impact, it's going to be very difficult to showcase the return on investment as you move up the analytics maturity model. So I think it's start small, pick projects that don't require a ton of data sources and show the impact and ROI. And then you can get that organizational buy-in, you can get the foundational support you need, and continue to move up the maturity model, take it on bigger and bigger projects as you start to amass more data.
Yeah, no, all of those are great points. I would say just our experience here at UPMC, really, I can't emphasize enough when I see where we are compared to other healthcare systems, that our journey in the sort of analytics space really was jump-started by the fact that there was an institutional commitment to build an analytics program, given that we all realized that we needed to be a more data-driven organization. And so, without that, it's a little bit of a catch-22 in that it's hard to show ROI or wins if you have not made at least the basic investment to be able to deal with the data, to be able to ask questions of it and derive insights. And so I do think that, to your points earlier, that institutions actually have to make the commitment to put their resources behind it to do it. So maybe we can switch gears a little bit about, we've talked a little bit about the hurdles and whatnot, but have you noticed any changes in the attitudes in healthcare regarding predictive analytics? Maybe Travis, you can get us started.
Yeah, sure. So maybe you've heard of this little thing that's been happening over the last couple of years in the healthcare system that's called, value-based care. So that's here to stay. And what that means is the shift from fee for service to fee for value is on. So providers and healthcare systems have to find new and more powerful ways to eradicate waste. And that's the biggest counterbalance of a successful healthcare system is the amount of waste, additional cost, unneeded procedures, things of that nature that are generated on a regular basis. Now, I think for an organization that's very large, an operating margin or profit margin could be something like 2 to 3%. And you really have to eke out every single percentage point there. And that's one thing where I think predictive analytics can get you from the 10-yard line into the end zone. You know, power is cheap, compute's cheap, cooling and storage are cheap, and software is better than ever. So leveraging those things, and especially around predictive analytics, can help you get that extra percentage point back on your balance sheet. And, you know, when you think about that, you walk that forward just real quick here, predictive analytics often use advanced models. Those models can sift through hundreds of thousands and millions of combinations of records at blazing speed and find things you may never see in BI. So using advanced analytics to find those needles in the haystack really can help you move to a more profitable way of delivering healthcare, directly laddering up to value-based care, directly impacting healthcare systems.
Yeah, no, those are great points. I mean, and Mona, you know, I still remember early on when we were starting having to sort of spend a lot of time almost, you know, doing evangelizing people as to the importance of analytics in general and predictive analytics. Do you feel, as you know, you've moved within the HHS that the attitudes have changed, or is it still, does it still feel like a little bit of an uphill battle?
No, I think attitudes are starting to change, but you know, it's interesting. I think for those of us who are in this space, that value proposition is really easy to make for data creating more value. I think if you're not in this space, and for instance, if you are in a leadership position within an organization like HHS, I think it's up to the rest of us to really demonstrate that ROI. And again, I think to Travis's earlier point, starting with projects that align with the overall organizational strategy and being able to demonstrate impact on that based on data, I think is the right pathway to move forward. And for health systems, I think, you know, one of the things we didn't talk about explicitly when ACO started and this entire movement is that really this entire approach is all about data and all about measurement. And it is absolutely a data play from the ground up. And yet our healthcare systems weren't equipped to be able to bring together that data, which is why I think some of the lag that we have seen and the results that we would have hoped for has been due to that lack of interoperable infrastructure within these organizations. But we are starting to see some real impact in things like managing chronic health conditions, for instance. You know, and I think that more and more organizations like UPMC and others are seeing that this really is about data and measurement, and how do they bring in not just potentially, you know, the data that they have, but resources and data that they may not traditionally have access to.
Yeah, and Mona, to that point of interoperability, could you expand a little bit on, you know, what should we expect in the horizon to as things that would help us, you know, leverage larger amounts of data? Because one of the biggest hurdles has been the interoperability issue. And certainly large institutions can say that they're dealing with big data, but if we wanted to ask, you know, real big questions that where one would need millions and millions of patients or observations, it would be ideal to be able to leverage data from multiple sites and different things. And so how do you see from a technical standpoint, what are you guys thinking in terms of the steps that will allow us to go over that hurdle of lack of interoperability?
So I think it's actually not just about the interoperability as we narrowly think about it from EHR integration. I think it's about getting sources of data that our healthcare systems haven't traditionally had access to. And the ways in which, for instance, some of the younger population interacts with the healthcare system are really changing, right? So
Yep.
a lot of those individuals, for instance, don't have a primary care physician, but they do, Google everything about their healthcare. And we know that those searches, for instance, a significant proportion of the social media searches are related to healthcare. How are we starting to use data, again, that is not traditionally within the purview of our healthcare system and really is sort of that big data? How are we starting to work with those sources, and what are the implications for privacy, for individual rights, and for how organizations leverage that information moving forward? I think those are some of the really big questions that we haven't really started to address as a sector yet.
Yeah, and I think that that's really a good summary of a lot of these issues that we see in terms of hurdles and whatnot. But one hurdle that we haven't really touched on is, what needs to happen for clinicians to buy into the use of predictive analytics? Because one could actually argue that, and I we've seen it, that we can have all our data we can have interoperability, we can start to leverage data that comes from beyond what lives in our EMRs and whatnot. But in the end, if the clinicians, if we don't buy into everything that we can leverage from predictive analytics, then it's a moot point. So Travis, what do you have any thoughts based on, you have had a lot of interactions with different healthcare systems and providers, and I don't know if you can comment on that.
Yeah, sure. I think this also translates to sort of everyday life, and where us as a general population consume predictive analytics. I think the key is it needs to be seamless. It needs to be directly integrated into physician or clinician native workflows. And there must be ground truths around building trust and transparency as much as possible until organizations, clinicians, caregivers, hospital staff, plan administrators are bought in. There was a great quote I heard when I was at the HIMSS AI and Machine Learning Symposium earlier this year from Dr. John Showalter. And I think this really translates. I've shared it a lot inside of GE and outside of GE. And the quote is, there's a model for trust in healthcare, and it's labs. Everybody believes lab results, but 10% of physicians can probably tell you how a modern lab operates. So we were having some conversation with my team the other day, and I brought this data point back around. We were talking about deep learning and artificial intelligence and neural networks and how they're really difficult to understand what's going on, sort of a black box to providers. And I think we have to do as much as we can to gain that level of trust. Look, you might hop in your Tesla and use Waze to get to work, but then object to using an algorithm to help you understand or support your workflow. I think using the most transparent ways possible to help organizations understand the validity of the predictions and how they can enhance their workflows through the ROI and just make life better for physicians, right? 49% of radiologists are experiencing burnout. Predictive analytics and upper level maturity analytics can really help with that throughput. Yeah,
that's certainly, those are certainly great points. And I would just add very quickly before I turn it to Mona that we have seen it's hard to put as good a predictive model can be from a neural net or from whatever in front of a clinician if they have not been part of the process. And we have found that, that trust transparency can be built, can be overcome by making us part of the whole process, understanding the data, its veracity and strengths and weaknesses, which then lends to, oh boy, I wish I could have a model to help me predict these types of things.
You know, real quick, like one thing that we think about a lot, and we kind of have these grounding truths at GE, and they're prevent bias, ensure clinical value, streamline collaboration, which is what you just nailed, and then validate constantly. Continue that virtuous cycle of validation with your collaborative partners, with government agencies, with other organizations. I think you just kind of hit on that, but it's really important for us to keep those ground truths in mind.
Yeah, Mona, what are your thoughts on this?
Yeah, I think, we first need to start with the questions that we want to answer, and make sure that those are the questions that are most relevant to the providers at the front lines. And then really nothing will bring providers on board more than the demonstration of effectiveness. And I think over time, as these tools lead to better management of patients, I think you'll get more and more providers on board, and I think you'll get leadership on board. But those for a lot of organizations, that is going to take incremental steps to get there. And you can't sort of start without first prioritizing the things that are most important to the frontline providers.
Yep, no, those are great points. One of the things that we saw in the survey, trying to figure out if there are examples out there of healthcare systems making real improvements with analytics, the survey identified 3 areas where respondents felt that predictive analytics could be of help, like the top 3: delivering more cost-effective care, reducing readmissions, and identifying at-risk patients. And I don't think would be a surprise to any of us that those would bubble to the top. But Mona, do you have, in your experience, have you seen any solid examples of health systems using predictive analytics to make real improvements in those areas?
I think there has been an incredible focus on identifying high-risk patients, and then targeting interventions to those, whether it's to reduce hospital admission rates or to deliver more intensive care to those patients potentially at home. And so that, I think, we have seen across the board happening at a lot of organizations that are more successful. From an HHS perspective, not being a healthcare delivery system, I'll just say that the other place that we see it is in being able to target providers that have inappropriate prescribing patterns, and identify behavior that is fraudulent. And I think those parts of the department actually are leaps and bounds ahead of others in being able to make sure that we are continuing to ensure that that providers are practicing appropriately, and that patients are not getting either prescriptions that they should not be getting, or getting billed for things that they should not be getting billed for.
Yeah, no, you bring up a great point. So maybe even as a transition to the next question, Travis, maybe we can blend both of these in your experience, seeing solid examples. Are solid examples out there limited to only large institutions, or smaller ones all over the place? You deal with all types of healthcare
Sure.
systems. So tell us what you've seen.
Sure, and you've hit it squarely. In my experience, I've dealt with 2 doc practices all the way up to some of the largest integrated delivery networks in the world. And I think there's more sense of urgency around eradicating waste for larger healthcare institutions. Smaller ones, they have the same challenges, but they may not have the same types of difficulties with data integration. They may not have multiple EMRs or multiple lab systems or multiple radiology information systems. So I have seen it work in the past. I think predictive analytics can work at any scale. It goes back to embedding things in native workflows. So if you're going through a traditional imaging workflow or lab workflow, and predictive analytics are embedded seamlessly into the application, it makes it very easy for an outpatient imaging center or a standalone physician practice or a large hospital to consume those. So I've seen it work in the past. I've seen examples on, predicting payment around claims denials and prediction of claims denials, which is a $210 billion anchor on the U.S. healthcare system. And I think it can. It just depends on what problem they're choosing to solve for, the data streams available, and where those results of the predictive analytics are being consumed. But I definitely think that it can be consumed on any scale.
Yeah, no, and I would say, certainly speaking from the perspective of a large integrated system, we certainly have seen that we've been able to accelerate our analytics activities maybe a little bit faster than other smaller healthcare systems that sometimes we talk to or we might give guidance to in this space, but that the need to deliver more efficient care is it's a pressure that we all have, and to your point, maybe the larger institutions, it's more front and center for them, but it's something that we all really have to deal with. Maybe we've talked a lot about foundational barriers and different things, but we all, I think, agree that there is analytics is here to stay. We need to use data to drive how we deliver care. And with this question about larger institutions or smaller ones, I mean, Mona touched on this related to, maybe what we need to be thinking more is about more hype technologies, right? With like wearables, AI, blockchain, to name a few. I mean, maybe Mona, you can help us and follow through on comments that you made earlier. Do you think that as an industry that we're ready to be thinking about these things? Are our state of maturity high enough to be thinking about these things? And maybe a comment that I'll ask Travis to, if the answer is yes, does that apply to all institutions, large and small?
So I'll say I don't think it's about a technology. I think it's about the data. And at the end of the day, what's prediction really about? It's about creating an algorithm, training, having enough training data, validating it, and then testing it. And so whether that data is coming from a wearable or from your EHR or from another source, I think you have to follow the same sort of rigorous methodology to be able to get to a point where you can begin to embed that algorithm in your workflow. So I do think it's really, getting to the basics and not necessarily thinking about the next technology, but really thinking about is that data going to be relevant to the question that you're asking? And if it is, then let's try to test that out and show what the impact of it is. I think we spend a lot of time hand waving and talking about wearables and AI. One of the questions I have is that there's a lot of information that's getting collected. So if you have 1,000 data points getting collected by a wearable, for instance, at the end of the day, it may be that only 10% of those of that data is actually relevant to making a decision. And for the creators of some of these technologies, I don't think that they are really there yet in helping us to think through about how to really use that data for decision making. And so I think it is really up to healthcare systems to really pause and think about for the problem, for the priority that they're trying to address, what are the right data sources and how do you bring those and validate those over time?
And those are great points. Travis, what do you think?
Yeah, I definitely agree with that approach of what's the problem that you're trying to solve and what's the data set required. When I think about wearables, the example I like to think about is the new fourth generation Apple Watch, which has technology to record your ECG and also a certified algorithm around arrhythmia. So one thing that we're thinking about is, we talked earlier about the 500 million ECGs we have under management with part of our Muse system. Is it clinically relevant to get that data in front of a cardiologist or a caregiver? So if things like atrial fibrillation or tachycardia or whatever other type of arrhythmia is conducted in a natural environment, is there value to surface that to the clinician? So that's something that we're exploring. Very much like Dr. Siddiqui said, is this data really useful? Is the data points on this ECG as good as a 3-lead or 5-lead, 12-lead ECG, right? And is it useful? So I think that's definitely right. We do see organizations, especially in accountable care models, looking to better understand what their patients are doing outside the 4 walls of your traditional healthcare facility, so in the home. So again, it's about the data that you need for the type of coverage or care you're looking to administer, and that's still sort of to be determined. We're seeing bits of information that are helpful, like Bluetooth scales, et cetera, blood glucose monitors. But then stepping into AI, I really think that you're going to see this dramatic change in the next 2 years with deep learning and it being embedded on devices at time of acquisition, sort of pre-scan, intra-scan, and post-scan, and really at critical decision-making junctures. I think the thing that we have to think about is there's a lot of hype around AI. It's probably the most overhyped or most hyped thing in healthcare, but it's really about getting that intelligence, again, I'm beating it to death here though, into those workflows. Where is it the best place to consume to have the most impact? And I think we'll see some weeding out of solutions that people were pretty excited about early on that'll give way to things that people can actually use without disrupting their native workflows. And blockchain, obviously, there's a lot of conversation about that. It seems to be very promising from an information exchange perspective. So if you think of things that Meaningful Use provided for, direct transmission protocol, all of those things about view, download, and transmit, blockchain seems to be what a lot of people are looking at for securely sharing that data. So you came back to interoperability, potential here for really ensuring that data can move freely and safely and securely around the global healthcare system.
Yeah, no, those are great points. And I would just say, from usually the advice I give my team, and echoing what you said and what Mona said, it's really all about the data. I'm less concerned about the technology, and our sort of mantra has been, we need to consume the data that will allow us to answer the questions that we need to answer, and we need to be intelligent as to how we use the technology that's out there to allow us to do that. And so, for the audience, I don't think any of us puts sort of the technology first, but rather it's all about, as you've heard, it's all about the data and using those data to answer the questions that we need. So with that, I actually want to thank our panelists, Dr. Mona Siddiqui and Mr. Travis Frosch. This actually concludes the webinar. And if you have questions, please tweet us at ConnectedMed using the hashtag Predictive Analytics Insight. And for more health IT content, please visit connectedmed.com. Thank you very much.
Thank you.
Thank you.